Hello everyone, my name is Priti Parmar. I am working as a nursing tutor in Knowledge Institute of Nursing, Anand. Today we will see about the hormonal injection. It is included in the temporary contraceptive method. In that, progesterone only injectable. In that, DMPA, depot medroxyprogesterone acetate. Its dose is 150 mg and it should be given at the intramuscular at interval of 3 months. Then NET, in that non it is sterone inanate. Its dose is 200 mg. It should be given at the IM and 60 days. Then DMPASE, its dose is 104 mg. It should be given at the subcutaneous and for 3 months. Then combined injectable contraceptive. Okay, these all are the example of these progesterone only injectables. This is the injection which are given for the contraceptive uses. Then combined injectable contraceptive in that progesterone and estrogen monthly once. Okay, this should be given at a monthly at one time. OD. Then subdermal implant. As per the name, subdermal implant means the subdermal. Okay, the implants means the medication or any instruments or rods which are implanted into the subdermal layer. Okay, below the dermis. Then Norplant. The elastic rods or capsules are implanted beneath the skin of forearm or upper arm. Mainly, it is implanted under the skin of forearm and upper arm. Okay, there are many capsules, or also it includes the elastic rods. Then contraception is provided for over 5 years. Okay, this implants contraception. These implants provides contraception for up to 5 years. Okay. Then drawbacks. Then what are the effects of this? So menstrual irregularity, and it should be given by the surgical procedure. Then you can see this type of implant are come. So implants is placed underneath skin of arm. Mainly, this is the site for implants. As you can see, this is skin applicator implants. Okay, like this is the one surgical procedure by which this method is done. Then now next is a vaginal ring. It contains levonorgestrel found to be effective. Mainly vaginal ring contains the levonorgestrel and it is very effective. Then the hormone is slowly absorbed through vaginal mucosa. The ring is worn for 3 weeks. Okay, as you can see in the picture, this is the uterus and this ring is placed at the vagina. Okay, as you can see, this is the vaginal ring which is placed into the vagina. Then post-conceptional method. Post-conceptional means if anyone conceive the pregnancy, okay, and after they want to discontinue, so what can they do? So there are some of the method. In that, the first is the menstrual regulation. Okay, then second is the menstrual induction. Then next is the oral abortifacient and MTP. These are the post-conception method. In that, first is the menstrual regulation. As per the name, menstrual regulation means to regulate the menstruation. Okay, aspiration of uterus contains 6 to 14 days of a missed period. If the period is missing for 6 to 14 days, then the contents of uterus is to be aspirate. Okay. Pregnancy should be confirmed priorly. In this, as I said in the last slide, that post conception means after the conception, what should be do? So, in that the pregnancy should be confirmed. Okay, for pregnancy is confirmed, and after that, what should do? So, aspiration of the uterus content. So, uterus content should be aspirates. Then menstrual induction, in that disturbing the normal progesterone and prostaglandin balance by intrauterine application of 1 to 5 mg of solution of prostaglandin. Mainly in that menstrual induction means the induction means to activate the menstrual. Okay, so disturbing the normal progesterone and prostaglandin balance by intrauterine application. So what should be insert? So solution of prostaglandin and its dose is 1 to 5 mg. Okay, so by that the menstrual is induced and it should be performed under sedation. Mainly this should be performed by the anesthesia. Okay, anesthesia should be given in this method. Then bleeding starts and continue for the 7 to 8 days. As we induce the menstrual, so bleeding is starts and it is continuous for the 7 to 8 days. Then next is the oral abortifacient. In that there are some drugs which are used. This is the mifepristone 200 mg orally, then misoprostol. These both drugs are given for the abortion. Okay, if any woman conceives the pregnancy and if she want to discontinue it, so she should be use this medication. But this medication only given by the or prescribed by the physician only. Then third one is the follow up. Okay, after the using of these drugs, the female should be regularly follow up to their physician. Then next is the natural methods of family planning. So what are the natural methods? So in that first is the cervical mucus method. As per the name, it is also known as the ovulation and weaning method. Okay, this method can be asked the ovulation method also or weaning method. So you should know that what are the two name of this method. So first is the ovulation method and second is the weaning method. And this method is mainly what this method is do. So it is prevent pregnancy and to check out your mucus every day and write the results on chart. Okay, so what should be you do? What should the woman should do in this method? So she have to continuous check out her mucus. Okay, mucus color should be checked in this method and write the result. What color is that mucus? Say she should write in the chart, and changes in mucus help figure out when you are when you are going to ovulate or pregnancy. So mucus color are different at different process. If you are ovulates, then mucus color is different, and if you are menstrual, so mucus color is different. So in that method, the female should be check out continuously the color of mucus. Then second is the body temperature method. Body temperature is also indicates the ovulation process and menstrual process. Okay, so if any woman continuously check the body temperature, so she should know that she is going to pregnant or not, or she is going to ovulate. If she is ovulate, the body temperature is slightly lower than normal. Okay, and if she is in menstrual period or the first day of that menstrual, so at that time also the body temperature is lower, and after the continuation of the menstrual cycle, the body temperature is becoming normal. Then next is the breastfeeding amenorrhea. In this, the what is the benefit of breastfeeding? So benefit of breastfeeding is breastfeeding suppresses the fertility. Okay, it suppresses the fertility, and because of that, any couple can regulate the pregnancy.